In this video, we'll discuss how to build general surgery codes using the MDBilling.ca software. If you're new to OHIP billing, this video tutorial will provide you with a good overview of the most common billing scenarios in general surgery. If you're in a surgical subspecialty, this video tutorial still applies to you. Although the service codes are different, the OHIP billing rules are the same. Simply replace the 03 in the service code with your 2-digit specialty code. For further understanding of OHIP billing, we kindly suggest that you familiarize yourself with the OHIP Schedule of Benefits, starting with Section A64, and review all the appropriate general surgery service codes and eligibility considerations. A consultation is eligible when seeing a patient who's been referred from a referring physician following a written request. Consultations are subject to limitations of 1 per 12-month period, unless a patient is referred to you a second time with a clearly defined unrelated diagnosis. In this case, the limit is increased to 2 per 12-month period. For example, if you're a general surgeon, you can use service code A035 when providing a consultation to a patient for the first time. When you see a patient and the consultation is longer than 50 minutes, you can bill special surgical consultation A935 at a higher fee. A valid diagnostic code and a referring physician billing number must be identified within the claim when billing consultation. There are 2 assessment services that can be billed by a surgeon. One is specific assessment and the other is partial assessment. Specific assessments are limited to 1 patient per physician per 12-month period, unless the patient is seen by you a second time with a clearly defined unrelated diagnosis. In this case, the limit is increased to 2 per 12-month period. Once the limit is reached, you can bill partial assessment for the following visits. For general surgery, the service code is A033 for specific assessment and A034 for partial assessment. For other surgical specialties, simply replace the 03 in the service code with your 2-digit specialty code. There are 2 premium codes for the most responsible physicians. The first one is E082, MRP Premium for Admission Assessment. It is eligible to the admitting physician who is the MRP and is payable only once per patient per admission. It can be added to consultation or assessment service code, where the service date and the admission date for the patient fall on the same calendar date. E082 is a premium that bills at a rate of 30% of the admission assessment service, the parent code. The second MRP premium is for subsequent visits, E083. It can be added to hospital inpatient visits such as C122, C123, C142, C143, C032, etc. E083 also pays 30% of the subsequent visit. Keep in mind that these 2 premiums cannot be billed on the same day. When 2 physicians are considered to be the MRP for the same patient on the same day, the physicians should communicate with each other and determine who should be billing the MRP premiums. The Ministry of Health will only pay 1 MRP premium, and it will be to the physician who submits the billing first. For example, you're called in to admit a patient for appendicitis at 4 p.m. on a weekday. He had lap appendectomy that night. We will bill the following: A035, E082, K960, K990, and S205. Subsequent visits, also referred to as inpatient visits, are any routine assessment in hospital, for example during rounds, following the hospital admission assessment. The definitions and payment rules for subsequent visit services begin on page GP28 of the schedule. It's important to note that subsequent visits are subject to strict quantity limitations. The automatic codes IPTXA and IPTMA are created to assist with billing inpatient visits in accordance with the admission date for the patient. IPTXA is used for non-MRP inpatient visits, and IPTMA is used when you are the MRP, in which case we'll add the E083 premium for you. Whenever you bill IPTMA, we will compare the service date against the admission date. Once you click Save or Save and Submit, we will automatically bill the appropriate inpatient code according to the rules from the OHIP Schedule of Benefits. As always, we suggest you become acquainted with the OHIP Schedule of Benefits before using this or any automation code. Please remember, special visit premiums cannot be billed with subsequent visits. For surgical codes that do not have a Z prefix, the service fee includes routine subsequent hospital visits occurring 1 or 2 days prior to surgery and within 2 weeks after the surgery. However, there is an exception that you can bill the first and second post-operative hospital visits, and you can also bill the discharge if you are the MRP. As an example, a surgery is conducted on September 29, 2016. The visits on September 27th, 28th, and October 2nd were not paid because they were performed 2 days before and within 2 weeks after the operation. However, the visits on the third day before the surgery and the first 2 days after the surgery were paid. For more information, please refer to Section GPSP1 of the Schedule of Benefits. In this module, we'll review a few time-based codes, such as Counseling of Patient, K013, Counseling of Relatives, K015, and Case Conferences with Other Medical Personnel, K121. Most time-based codes are billed in either 10 or 30-minute time units, or as specified by the Schedule of Benefits section. For every time unit, enter a quantity of 1. For example, counseling a patient using code K013 and spending 50 minutes of time. Since this code has a 30-minute time unit, we'll use a quantity of 2 as we've spent 50 minutes with the patient. We suggest that you review the OHIP Schedule of Benefits pages for each of the time-based codes to determine the payment rules and time calculation details. Please be aware that when billing more than 3 surgical procedures to the same patient on the same day, the claim need to be flagged as manual review, and the operative notes may be requested by the ministry in order for the claim to be reviewed by the medical consultants in adjudication. The process may take 2 to 6 months depending on different cases. When more than one procedure is conducted by a surgeon under the same anesthesia or within 14 days during the same hospitalization for the same condition, the major procedure will be paid at 100% and the other procedures will be paid at 85%. We have a useful feature under Preferences for you to apply 85% when billing multiple procedures. Instead of calculating the value of the second procedure manually at 85%, we've created a button on the claim entry page. Simply enter the procedures for the surgical day and click on the 85% button to adjust the value of the claim accordingly. You can also configure the percentage that you want to apply to the surgical codes. For example, you want to apply 185% to the operation of breast reductions. You can go to the Preferences and then enter 185 here. You'll then be able to select the Apply at 185% button in order to adjust the claim value. After our premium codes, such as E409 and E410, are percentage-based of the surgical code. You'll need to associate the premium code to the parent surgical codes in order for our system to calculate the proper fee for them. For example, you're home at 6 p.m. and get called in by a gynecologist for an undergoing abdominal hysterectomy to a patient who has an intraoperative small bowel injury. You perform a small bowel resection with anastomosis. You will bill A035, C962, C994, S165, and E409. There are also other premiums you can include for procedures. As an example, you operated on a female patient who was morbidly obese, BMI 42, with a bowel obstruction. You will bill S177 and E676. When resuscitation is required to be performed on a critically injured patient, these life-threatening critical care codes are payable to the first 3 physicians. G521 for the first 15 minutes, G523 for the second 15 minutes, and then G522 for each 15 minutes after the first half hour. Please note that these codes cannot be billed with other critical care codes, and they also include these services. When procedures are performed by 2 surgeons at the same time, one surgeon should claim for the surgical procedures, and the other surgeon should claim the time unit fees. Please note that the operative note may be required by the Ministry of Health when more than one surgical assistant has participated in the operation. The B suffix should be used when billing surgical assistant codes. For example, for a cholecystostomy, the service code is S278B. The amount payable for the surgical assistant service is calculated by adding the number of basic and time units and multiplying the total by the surgical assistant unit fee. The MDBilling.ca system will help you calculate the total number of units by comparing the start and end time and automatically adding the basic units for the service codes you're using. There are two features in MDBilling.ca for you to calculate how many units to bill. The first feature is the default unit calculator. By enabling this feature, the calculator on the left menu will calculate the time units based on the start and end time you enter. For example, you provided surgical assistant services for a cholecystostomy from 7 a.m. to 9 a.m. You can calculate the time unit here, input the quantity, and add entry. You will notice the 7 basic units for S278B have been automatically added to the quantity. You can select your default calculator type by going to Preferences, My Preferences, Default Unit Calculator. The other feature is to enter the start and end time directly on the claim entry web page. By enabling this feature, you'll be able to enter the start and end time directly on the claim entry web page, and the quantity will populate. When using this feature, you'll need to enter either the start and end time or quantity, but not both. In my previous example, I will enter S278B and enter the start time 7 a.m. and end time 9 a.m. You'll notice that the time units and basic units are automatically calculated. After-hour premium codes, such as E400B and E401B, are percentage-based of the surgical assistant code. You'll need to associate the premium code to the parent surgical assistant codes in order for our system to calculate the proper fee for them. In addition to after-hour premiums, surgical assistants can also bill special visit premiums for non-elective surgery. Please note that special visit premiums for surgical assistant services are only eligible for payment for the first patient seen on each special visit. As such, the physician is required to travel from one location to another location in order to bill these premiums. As an example, you're called in from home to provide surgical assistant services for a cesarean section from midnight to 1 a.m. You will bill P018B, enter the start time and end time, and then E401B and select the box here to associate the premium to the parent code, and then add C99B if this is the first patient in this visit. When a referring physician or nurse practitioner initiates the telephone consultation with the intention of continuing the care, treatment, and management of the patient, a K730 can be billed if you are the referring physician and a K731 if you are the consultant. If the telephone consultation is initiated through Criticall, a K732 can be billed if you are the referring physician and a K733 for the consultant physician. Besides the service codes we've mentioned in this video, here are more commonly used service codes for surgeons. Please refer to the Schedule of Benefits for all of the limitations and eligibility considerations. Thank you for watching this tutorial. If you need further help, feel free to contact our support team, or you can always upgrade to the full service plan. Whatever your needs are for billing, we are here to help you save time and earn more.